Well, good morning. My name is Harvey Michele, and I've been living with HIV the last 25 years. I also like to acknowledge the territory that I'm a guest on. I live in Montreal, which is Georgiagi. And I like to take a couple seconds just to remember those that already passed on to the spirit world, even with the non-Indigenous communities. They're what makes me work more to sensitize people living with HIV, and that's my work. I live in Montreal since 40 years, as the animator had just mentioned. On March 1994 is when I became HIV. That I know anyway. I was already here in Montreal. I was 33 years old. At that time, the average age was around 32, 33 when I became HIV. I was one of those two-spirit persons that felt that I was not. I was educated enough not to contract HIV. However, because of my addictions with alcohol and with pills, not too much with cocaine or any hard drugs, and I had little experience, little marketable skills, and I had to find a way to survive. At that time, in the early 90s, we had the welfare was less, and we had to try to find men that were over 30 years old who could get full amount of welfare. So we had not enough money as an individual to get a room or a small apartment, and we had to try to get somebody that was older because they were on welfare. They got the full amount that could afford welfare, and because of my alcohol use, I guess, to survive, I always drank. It's only beer I drank. I felt awful at times, but I had to do what I had to do. So then even at 33, and prior to that, I was already engaging in commercial sex or survival sex. Notably, I was in the red light district on Saint Laurent, St. Catherine, in the early, when you say 40 years ago, it was a very good place to pick up tricks, and the gay village was just starting to emerge as a cluster of bars where we could find men that wanted sex for money. I wanted to have sex with money, so I would go at the spot, but mostly we would go dancing in the West End, and finally more bars were opening as we know, in the gay village now, as it is called the gay village. Even today, I pass by sometimes. It just I always go there. It's a part of my history. It's part of myself, I guess. It's like I'm coming home to a neighborhood where I lived 18 years in Centre Sud. It's even today when I go on the corner of St. Catherine and Papineau, where McDonald's was. I guess they're moving, but there used to be Tavern St. Catherine. That's where it was easy to find men to have sex. And you got to remember at that time in the early or the late 89, 1990, we started to have HIV into the gay community. Obviously, we heard about it when HIV and AIDS was starting as, I guess, what we call an AIDS epidemic, notably in San Francisco and New York. And finally, it was starting to hit Montreal. I was negative then, thinking that I knew how, but I guess I didn't, because most of my men, I kind of looked at them and I said, he looks clean, he's okay. I could get more money having unprotected anal sex. And even at the time, having oral sex, and even for myself, I laugh at times when I'm sitting at that same spot. 40 years ago, I wanted a gold charm from this man, and he said, if you want it, you have to do a blowjob, and you'll get it. So I went to the bathroom because I knew the risk was low. And it's amazing when I think about it, and it was just very quick, and I was so visual, I guess, to try to think that this person would not give me HIV. However, as I drank more and more, where I would have in the state of blackout, and then I would have I would come with men. I would go home with men. They had sex with me. I just need it. So it's kind of like a block. I just needed to have a place for myself. I then met this man who we both became HIV. When I lived in the village, I was still living in the village, and we heard about testing, and my ex, I guess, strongly suggested that we do not have anal sex because until we got tested. And I said to myself, I wasn't going to be positive because I think that I'm careful. And so we both got tested in February. That we both went in for our results on the corner of Amherst, well, used to be called Amherst, and de Maisonneuve at Clinic Actuel. And I was kind of like already half drunk going there because that's when our appointment, Dr. Lefebvre asked us to come. And that's when it was my turn, and there was no, it's amazing when I think about it, there's no post counseling or anything. The doctor said that I was HIV, and it just went into one ear and the other, and I went in back to my chair in the waiting room, and my ex went next, and he else came down. As we went down to the elevator, he started to argue with me. He said it was my fault that he became HIV as well. And it was quite a shock, but it was in a state of denial. That was just a diagnosis. When I look back at it, I felt that how many other people I must have infected as well, because I did have I was active. I wasn't passive, but I was having sex, even with men that wanted to be, there were bottoms that wanted to be top. So I just did it, and condoms were not part of the equation of all I just needed is either $20, $40, $60, just that one trick. And it was quite a time to look at, when I look back, we started to have more and more people with HIV AIDS in the village, but we didn't know who. We kind of thought if you were a bottom, you were more likely to be HIV, but we had to do, as sex workers, we had to look for those men living outside the village, notably in the suburbs or St. Therese. I had a good client there. I knew that I was less vulnerable to get HIV. Even though I was HIV, I didn't tell them, you know, and it was quite a numb time for me. I come from a community where culture is important. However, living in the community, in the gay village, I didn't feel that I was not in tune with my culture. I felt I just had to survive. So I met another man who also helped me as well. And once I decreased my alcohol consumption, and I started to go to AIDS service organizations. Notably, I went to HCCM to get support, as they say, go support. And it wasn't much support because we went into the living room and we exchanged conversations with other persons living with HIV. There was social workers available, yes, but it was just not much. We didn't have much tools to work with. On the other side, we had Maison Plein Cœur was more. It seemed like I got attached with them more because they were more like real. They had their office. They had their house on Penn Street there, and I would go there once in a while, and I started to decrease my my alcohol consumption, but I still engaged in sex trade. My CD4s, when I was diagnosed, it was quite low, and it was supposed to be under 500. Would be was the time to start taking medication. And at that time, the first generation of antiretrovirals they only had not too much in the cabinet, you know. We had just AZT and other medications. I remember them, but I would be prescribed with them, and then because I drank, I would end up vomiting them. I couldn't hold them, so I stopped them, and then my doctor, I went back in there 3 months, and my CD4 just went up, but it went down again. So it was just like there was no attachment with myself, with the clinic. The doctor was not a healthcare professional that I worked with. He was just the one just always giving me things, and I didn't even comply. So there was really a disconnect. And I would go back onto the street. It feels like I was more connected with the streets, and there was this camaraderie of friends that I know from the streets. we, I guess, as Indigenous people, even here in Quebec, we knew who would be HIV, who would disclose amongst each other. It was amazing how we had another project on corner of St. Lawrence and Ontario. It was called the Urban Aboriginal AIDS Project. And we had an educator there that was seemed to be more in tune with me. I guess when I look back on it, it was more culturally appropriate for me to see that person as opposed to going to a different organization to start to find out where what's this diagnosis that I have called HIV, and it became it was like a shift. It was like getting a gift from the Creator, and I said to myself, "Isn't that funny? I got a gift. How am I going to share the gift? Because this is a gift that the Creator gave me. It seemed like instead of turning it a negative, like it became a positive." So once I got him, I was sent to Halifax. Was sent with this coordinator to different conferences about HIV, and I came back and I was getting more and more involved, I guess, with that. And even prior to that, I served at the steering committee with Omega Cohort. That was another group of like-minded individuals that were designing programs and stuff and research and different steps that they were taking to initiate programs for the gay community. And Dr. Joanne Otis, who was at UQAM, was the lead or the investigator of the cohort there. So I felt more and more attached to the community, and even to the Indigenous community, I was attached. And I figured it's not the same when a non-Indigenous person was diagnosed with HIV as opposed to an Indigenous person. It was quite I didn't know what to say. I still don't know. It's like it's a disease, and even that word, it was a white disease. It's a gay disease. And white meaning, I'm not racist by saying that. I hope I don't offend anyone, but we figured that was from a different population infecting us again. And even though here in the last, since HIV AIDS began, over 40 of us individuals here in Quebec that are First Nations have passed on, women and men that from this from AIDS related complications and stuff. So I was more and more empowered. So I was like an evangelistic person, more opportunities, and off I go, So off I go to tell the communities all over here in Quebec. I would travel and go to radio stations, schools, the band councils, in the hall, telling that HIV is preventable. And I was like, there were people already in Canada that were like a poster child of the Indigenous Indigenous world. Notably, we have Keisha Larkin, who was HIV. She spoke out, and here I was trying to say, not save the young people, but save the communities. And I think when I look back at it, I am sure I must have had some impact because it wasn't what I thought it would be. I thought it would be worse because most of the infections with HIV are down south. And we figured that if they went back to the community, not to tell anyone, confidentiality and stuff, they would not infect the whole population. Because when we think about the high rates of STDs or ITTSS, it is very high, gonorrhea, syphilis, and all that. And it's the same way that we get HIV through unprotected sex. So that's one way. And the other way is obviously is intravenous drug use contemporarily, you know. So I'm surprised we haven't had a rise of HIV numbers, even though Ontario and Quebec do not identify the blood that analyzed as there's no identifier to say how much Indigenous people were tested for HIV and AIDS. There's no way to actually find out how much people are infected with HIV. Even as we continue living with HIV, there are different components, notably the mental health. I'm so happy, even for me, when I look in the mirror, I have scars from my cheeks because I've taken a medication and which caused lipodystrophy. And way back then, we had a group at CIPAV who addressed that, and it was a result of one of the antiretroviral medication, the sinking of the mouth, I guess, not the mouth, but the cheeks. So luckily, I don't have a hump on my back, on my neck. So what worries me also now are also individuals or the youth in Quebec. There's no strategy. We had a strategy in Quebec City with the Quebec Health Social Services of Quebec Labrador. It was called the Circle of Hope. I served there 10 years from 1990 to 2000. I was on the working group from 1998 to 2000. And then we implemented the Circle of Hope provincial HIV Inuit HIV strategy. But because of the funding, it was cut in 2010, which is 10 years ago. And obviously, I applaud the initiatives of MIELS-Québec, because at least you have included, even engaged the Indigenous people in this process of protection, I guess, even by having this dialogue. I'm hoping that it could resonate with other communities. We do have the Indigenous people that are using IDU users, not just men that have sex with men. The term, as I thought about it today, because was I ever a person having sex with men? Yes, I was, but I didn't identify myself as gay. It was also an identity thing, because again, this gay thing, or it was something that wasn't me. I wasn't one of them, I guess, even though I come from the community. But that's still the momentum of prevention and education was quite strong. Even when we had Ron Farah, who gave me a spice of life, I guess. We keep walking every year, even with his mother, Evelyn, with the Semash. Even the 20 years it lasted, the numbers kept going down, 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 whereas there were only a few thousand. And then that importance of prevention, even education in the media. And it's not just World AIDS Day on December 1st that HIV is preventable. When we look at it across Canada now, it is definitely a group that is quite needs education prevention as well. Notably, we have hotspots in Saskatchewan and Alberta as well. It used to be the downtown east side where high rates of HIV, but it's spreading more in Alberta, in Saskatchewan, in Regina and Saskatoon and other First Nations communities. This is what I'm hoping that will not turn out here in Quebec. We just hope that the medical directors of First Nations here in Quebec, as well as the CHRs, as even with the social workers, as they work in teams at the health center or at the health center, the doctor comes in every week or every 2 weeks. Blood work is quite a challenge because they have to bring it down south to get it analyzed. Of course, rapid testing and stuff like that. But there's no correlation with, it seems like, with high rates of chlamydia and gonorrhea, and that does not, it's not a red flag, even for First Nation, even though they are maybe 3-4 times higher the rates of sexual sexual infections.
Harvey, just letting you know that you've got 5 minutes left.
Yeah.
Thank you.
So it's quite an area that I hope help people will understand. And my sister, who was HIV as well, she contracted HIV through her partner, and my sister was not intravenous drug user. She was not a sex trade worker. She was not any of those homeless lady, all these. She was just a woman that was infected with HIV, and she passed on 2 years ago, not from HIV, but she had cancer after, so it's quite a shock for me. Even though I'm living with HIV last 25 years, it seems like that long-term survival's guilt is in my radar, I guess, as I see a lot of ones that have different lifestyles, the ones that are living precariously. There's a lot of no access to health. Even today, I serve at the patients committee at the Montreal University Health Center to advocate access to with HIV and stuff. I'm quite well known there. So I'm just hoping that this dialogue begins, or even has a seed of engagement with the Indigenous communities. We also have the Inuit, even from Nunavik and Nunavik, that are living with HIV. Even some are in the community, but there's a lot of us who are living down south. So we need support. I guess that's basically what I'd like to say, just that we need support yeah, and I'm hoping that through this format or platform of having a Zoom, it's quite important locally, even provincially. Even in Quebec City, we have the people that are street involved that need to be educated, I guess, as well as distribution of information in different communities. I would leave it like that, and I thank the organizers, namely Camille, Madame Thibault. She reached out to the Montreal Indigenous community to have somebody speak at this important conference, I guess, to talk about HIV or even prevention stuff. Well, thank you very much. And if you have any questions, I can hardly see the questions here because I just had eye surgery last 2 weeks, so I'm just hoping that everything will be okay. So what is the situation in Aboriginal communities? Distance in, I cannot even see, it's, yeah. So anyway, thank you very much. And thank you.
Thank you, Harvey. Did you want me to translate the question for you?
Yes, please. Oops.
Yeah, okay. So it was René Cormier was asking if the situation for the Indigenous communities that are far away, is there like any needs in terms of support for Indigenous people affected by HIV, and is there a generational issue regarding that?
Well, yes, we do need support, and thank God for confidentiality, and because a lot of people live in the community, and they trust the healthcare professionals at the health station. We also have social workers that could have access to through the internet. And when you said multi-generational or intergenerational, but I mean, you got to remember the demographics of the communities as well. Over 2/3 of the communities are young. There's not too much older people. So so prevention, I guess, would be or yeah, prevention, material support, an 800 number or stuff like that would be sufficient. Anyway, thank you once again. Thank you to the organizers.